Hello, this is Dr. Nicole Meade from Otsuka's medical team. Today I'm here with Darcy Leon. She is a psychiatric nurse practitioner in an outpatient psychiatry setting. This is part of the Meet the Treatment Team series of interviews. Welcome and thank you for being with us today, Darcy.
Thank you for having me.
Great. So we're excited today to learn a little bit more about the role of a nurse practitioner on the treatment team. I'm going to start today's interview with the first question, which is, what is your role in the treatment team?
As a psychiatric nurse practitioner, I diagnose and treat mental illness using a holistic and person-centered approach, meaning I prescribe medications, provide psychotherapy, and most importantly, work with patients to address all areas of their lives that affect their mental health.
Great, thank you. Now, tell us a little bit more about your goals that you have in mind for that initial visit with the person that you're meeting with, and then all the visits thereafter.
Sure. In my first visit, my main goal is building a good working relationship with my patients. Building trust can take time, but establishing open communication early on can lead to better results later in treatment. But as we move forward in our work together, the goal is not only to treat the primary illness, like depression, anxiety, or bipolar disorder, but also to address the other things that affect mental health, like your home environment, past traumas, stress at work or school, or other medical problems.
Great. Thank you for your insight and perspective onto that question. The last question we have today are, what are your thoughts on shared decision-making with the individuals that you're working with?
Shared decision-making is a big part of my practice, especially when it comes to medications. I want my patients to get the treatment that will help them the most, but I also know that people are more likely to stick to what they're comfortable with. So I tell my patients it's a two-way street. I'll make the recommendations, but I also want to hear your fears, your expectations, what your friends are saying, what you've read on the internet, how you feel about the medications I'm suggesting. That way we can work together to come up with the most effective plan.
All right. Thank you so much, Darcy. We appreciate your perspective into the ins and outs of what it is to be a psychiatric nurse practitioner on the treatment team. Thanks for taking time with us today.
Thank you.